I'm one of the learning disability nurses, and I'm based in a team which is called the Health Facilitation Team, which is made up of about 20 people, some of them matrons, some of them health facilitation nurses, and some of them healthcare assistants. And we work across Bradford and Keighley and support people with learning disabilities in making sure they get all their healthcare needs met. So we'll work with people at home or people in residential homes, and sometimes we offer support to people in nursing homes, some people that live in supported accommodation. And what we will normally do when we first get a referral about somebody is go and visit them at home with family and carers or support workers or whoever knows that person really well, and we'll complete a health assessment. We would do the person's blood pressure, we'd check their pulse, we'd have a look at their feet and make sure that their toes and their feet were okay. We might ask them to do a wee for us, and we'll check the wee sample that they've given us to make sure there's no blood in it and no sugar in it, and that they've not got any infections in that. We would look in somebody's ears to check that they didn't have wax in their ears and that they could hear properly. We might have a quick look in their mouth and see what the teeth are looking like, and check that they've been to the dentist recently. We'd weigh people, we'd see how tall they were. We'd work out whether we thought that person maybe needed to lose weight or maybe put a bit of weight on. We'd talk to them about their diet and what they were eating, making sure that they were having a healthy diet. And from all that information, we'll write to the GP and ask them if they've got any information that we need to know about. We'll work with that person then to draw up a health action plan, which identifies the health needs that person has and how we're going to support them. So, for instance, if you had diabetes but you weren't managing it very well, we could work with you and the dietitian perhaps to look at your diet and what things you should be eating and what things you shouldn't be eating, and making sure that you're accessing your appointments with either the GP or the diabetic clinic up at the hospital. We could go with you and make sure that you get to that appointment, and we could make sure that when they're giving you information in that appointment that you're understanding the information that you're being given. So you might come and see me, for instance, like we've said, if you were going into hospital and you were having an operation done, you might come and see me if you think your GP doesn't spend quite enough time explaining things to you very clearly. You might ask if we could come to the GPs with you and just make sure that you understood what the GP was talking to you about. You might come and see me if you needed to see the dentist, because let's say you've got toothache but you didn't like going to see the dentist. So we could do some work around getting you used to going to see the dentist and talking about what they were going to do to help you and how that might make your mouth feel better. We could talk to you about making sure that you're brushing your teeth properly and all the sort of things you need to do to keep your mouth well. We might work with you if you needed to have some bloods taken, for instance, but again you didn't like having that done. We might work with the GP and the practice nurse maybe to make that a bit easier for you to do. We might work with you if you were at school and you were coming up to being in your last year at a school and you were going to be leaving, and you'd be leaving the paediatricians behind and you'd be leaving all the children's services behind that you've worked with maybe for the last 18 years. And so for some people that's quite scary to wonder who's going to support them once they've finished at school. So we'd work with you and make sure that you knew about all the adult services that were available. So you knew who the adult physiotherapist was, for instance, or you knew who that you needed to go and see about if you needed some equipment at home, that you knew the right person to talk to you about that. Or maybe you need to make sure that your wheelchair's been checked before you leave school, and we could support you with accessing wheelchair services. All those different things that needed to be in place before you left school and all your services changed. We would write a health action plan that would detail all the different people that would be involved with supporting you with that. So we'd try and work really closely with your GP, and we'd really be encouraging people to go and have their annual health checks, which everybody with a learning disability who's over the age of 18 is entitled to an annual health check at your GP's. It's a bit like an MOT. You just go and see your GP and they will go through various different things with you and make sure you're as healthy as you can be. So we would work with your GP, we might work with the district nurses. If you're going into hospitals, we would work with the hospital ward staff maybe about making sure that they support people appropriately up there. We'd obviously work really closely with families. If somebody lives at home with their family, then we would liaise a lot with the family to make sure families were aware of how to support somebody best. Maybe that the family needs more information about how to look after somebody if they're not very well, things like that. We obviously work very closely with the other clinicians who are based at Waddy Loves with us, so people like the dietitian, the speech and language therapist, the occupational therapist, the physio, the psychologist. Some of the doctors may be based up at the Highfield unit, so the psychiatrists, we would work with those. So we'll work with a real mixture of different health professionals to make sure people are getting the appropriate support that they need. So if you wanted to ring and speak to a nurse and see if we could help you, what you would do is ring Waddy Loves, and the phone number for Waddy Loves is Bradford 497121, and you could ring yourself, or your family could ring, or your support workers could ring, or your doctor could ring, and you could ring and you'd ask to speak to the nurse on duty, and you'd just talk to them about who you are and what you think it is that you need some help with. So for instance, if you were going to go into hospital for an operation but you were a bit nervous about it and you wanted some extra help, you'd ring and speak to the nurse and say, this is what's happening to me, do you think one of the nurses could come and support me with that? Yeah? And we'd probably say, yeah, we'd love to do that.